Next question will start with Mr. Easthouse. As a charitable trust and instrumentality of the city, LMH Health has a vital and unique role in the community. Beyond approving hospital trustees, what do you see as the role of the city with the hospital, and what would you like to see improved, if anything?
Well, I was very happy. I believe we approved on the Public Incentives Board some tax abatements for the LMH West facility that is going to be under construction shortly. So, you know, the hospital is key to our community. I will be perfectly honest. The interaction between the city and the hospital is now one of my strong points. I do not know everything about the intricacies of the connections. That being said, I'm open to learning and I'm opening to listen. I can't learn everything, unfortunately. I would love to be able to sit down and learn more about that. Frankly, it's one of the what do you need and I'll stay out of your way sort of situations. I want to make sure we have a strong and vibrant hospital for our community.
I think under Russ's leadership and the board, Cindy's and others, their leadership, they've set an example of being a partner with the county, being a partner with Burt Nash, being a partner with DECA, and being a lead agency in many of the advances we have. And to me, that I want to see them continue to do that. I mean, continue to be a partner that moves this community forward. You know, I've had discussions with lots of people, including Russ, about the idea that, you know, that health is just not about going in and seeing your doctor. Health is much more important than that. From affordable housing, housing first, you know, all the way through the social services, you know, for a continuum of care. And I think that's what the direction the hospital has been going recently, and I think we're going to see them continue on that. As one example of that, I'm on the Family Promise Board, as I've mentioned, and the hospital is allowing us to use 9 of their properties to help as transitional housing. And I think that's a type of partnership that we need to continue to see.
For my organization, I represent our interests in the State House. So I advance policies like Medicaid expansion and ways that we can increase access to food stamps and other social services in our state. So I promise to keep doing that. I'm really interested in exactly that, like looking at how the city can partner with the hospital and the health department to advance like a culture of health in our community. So that way we built healthy environments, we create ways where people can start accessing food and nutrition more effectively, all of these things. And so I know, like in partnership with the city before, we worked to expand access to summer meal sites. That would be an amazing opportunity to move forward. Also working with the school board to support the school nutrition staff to expand after-school meals for kids in town, so that way they can get that additional nutrients moving forward. So those are the things that I would be really interested in doing on City Commission to help the hospital.
Whether you are a business owner, someone who's looking to start a business, someone who's looking to build a home, maybe you're looking to pull a permit, whatever you're doing, you've got to interact with planning development services, right? I think at the city staff level, we probably could have done a better job at facilitating quicker groundbreaking with the West Lawrence campus for LMH Health. A lot of that lies with PDS. It created an atmosphere of headache, and I don't know what went on or what didn't go on behind the scenes fully, but city commissioners who intervened skillfully on behalf of an applicant who's a community partner like LMH Health, with this in coordination with the city manager in PDS, can keep costs lower than they would have been otherwise, and just make things easier when it needs to be easier, intervening skillfully.
right?
Obviously, our hospital is one of our greatest assets, and I'll just tell you a little story as fast as I can. Actually, my very first sort of civic lesson here in Lawrence was like in junior high. They wanted to bring an HMO into Lawrence, and it's still to this day the biggest city commission meeting I've ever seen. They had it at the Holodome. As far as I can tell, the entire town was there. Every doctor in town spoke. I think maybe even every other person in town spoke. And that's not just where I learned how engagement is important, but also how important this hospital clearly is to us. And again, I would agree with some people encouraging good relationships with other partners. That being said, I do want to answer this question, or maybe someone can tell me later. I did sort of notice that the billing was moved to Kansas City, and that's confusing to me when we have people who need jobs here. So that's something I've had a question about actually for a long time. If anybody wants to tell me the answer to that, I'll be eternally grateful.
I think we need to appreciate our city hospital. They do a great job for our community. Thank you very much. I think it's important to have good relationships and conversations with the director and the trustees, and that's an important part of being a city commissioner. Understanding what they're doing, and frankly, relying on their leadership for, you know, a significant segment of our nonprofit community that's working in health fields. I mean, that's what we need to do. We need to appreciate them, rely on them, and kind of stay out of their way.
Thank you. That concludes our questions for today. I'd like to thank our sponsors again, Intrust Bank and SS&C, and also Aceli's. Thank you for responding to our additional people as quickly as you did. And a special thanks to the candidates for attending today. Have a great day.